positive cases of COVID-19 is a major part of ending the pandemic. And for this, Nigeria has put in place 9 laboratories while working on more across the country. In Lagos, the epicenter of the virus, 3 laboratories are in place and have been able to detect over 100 cases. On Panorama today, we will take a look at the effectiveness of these laboratories and the response of the public. Our guest today is the Director General of the Nigerian Institute of Medical Research, where one of the COVID-19 testing laboratory is located in Lagos. I am Dotun Okuyemi. Many thanks for joining us. Six new cases of COVID-19 have been confirmed. 2 in Kwara, 2 in Edo, 1 in Rivers, and 1 in the Federal Capital Territory, bringing the total number of cases in the country to 238. 35 persons have been discharged and 5 deaths recorded. For a breakdown of cases by states, Lagos has 120, FCT 48, Osun 20, Edo 11, Oyo 9, Bauchi 6, Akwa Ibom 5, Kaduna 5, Ogun 4, Ekiti, Enugu, Rivers and Kwara have 2 cases, while Ondo has 1 case. As the lockdown continues, Lagosians are applauding the government's desire to maintain a coronavirus-free society. Annie Daniels reports that they are optimistic the step will yield the desired results.
On this day, the lockdown is still effective in the metropolis. The roads are almost deserted with very few pedestrians. Shops and offices remain under lock and key. I'm standing right at the Keja roundabout. This area has always been a beehive. Today, however, the story is different.
Yes, nobody prayed for what happened, but all of a sudden we are seeing it. And as we are seeing it, the government will help our people, telling people to go inside. Yes, we obeyed.
For them to keep us at home for good for 14 days, it's all right. Because I believe that after that 14 days, we are going to discover somebody who have that kind of that sickness.
Respondents also commended the stimulus package made available by the government, but advised that it should be effectively monitored to ensure an even distribution.
And I was hearing that people are donating. People are donating what to share to people to eat.
Meanwhile, our camera lens caught these men under one of the bridges in the metropolis consuming various kinds of alcoholic drinks without adhering to social distancing rules.
All those not be sitting together. Me, I don't believe maybe anything there is all those sickness there in Nigeria, even though it did. Nobody that one go say, make a no touch them, make a no things together. That one na scan.
They told us that this drink is the one to prevent or sanitize our hands. That is why we are here taking it.
So take from morning till night. So take a go from morning till night.
While we are taking it, the lady always organizes something for us to eat.
Respondents also expressed fear that the lockdown might be extended. In Lagos, Annie Daniels, NTA News.
President Muhammadu Buhari has given approval for a 500 billion naira stimulus package to keep the economy going after crude oil prices fell more than half the budgeted benchmark in the wake of COVID-19. Leah Babatunde was at the Ministry of Finance, Budget and National Planning, where the Minister, Zainab Ahmed, has been speaking on the planned spending.
There is eminent risk to food security. The President has approved drawings from the Strategic Greens Reserve. The Nigerian Customs had in its custody a lot of rice that has been seized, and there's 150 trucks of rice that is now being handed over to the Humanitarian Ministry for distribution to the states across the Federation.
Minister of Finance, Budget and National Planning Zainab Ahmed say the proposed intervention fund will be utilized to upgrade healthcare facilities, finance federal government's interventions to support states in improving healthcare facilities, finance the creation of a special public works program, and fund any additional interventions that may be approved by the president.
We will be engaging with the insurance industry to package special crisis healthcare insurance, which is life insurance for healthcare workers.
While seeking private sector support, Nigeria will be tapping into her $3.4 billion savings with the IMF, a $2 billion facility from the World Bank, and $1 billion from the Africa Development Bank. In a bid to ease the debt burden on states, a moratorium window has been opened. The federal government aims to generate at least 1,000 jobs in every local government area of the federation, enhance food security and critical medical supplies, as well as appropriate stewardship of donated items and funds.
We want a different group, an independent group that will comprise of private sector and a few government officials to monitor the use of the funds on a continuous basis, and reports will be rendered to the public on a continuous basis. Our target is to ensure that there is complete openness about what has come in and how the funds are utilized.
The proposed amendments to the 2020 budget, she says, will provide for the COVID-19 Crisis Intervention Fund and other adjustments required. The Treasury single account is also being restructured as directed by President Buhari to better mobilize cash donations to create flexibility and build coalition with financial institutions while maintaining the sanctity of the TSA. In Abuja, Leah Katung-Babatunde, NTA News.
The federal government says it is not only depending on healthcare materials from outside the country, but has since been looking inward on locally made products. Permanent Secretary, Federal Ministry of Health, Abdullahi Mashi, said this when receiving some COVID-19 prevention items from members of the Pharmaceutical Society of Nigeria in Abuja. Oluseyi Adeagbo has details.
Cases of coronavirus in Nigeria might be rising, but health workers and partners are not to be relenting in their efforts towards ending the spread as supports continue to increase, especially to workers on the front line, and taking note of the unavailability of some necessities like hand sanitizers and face masks at a public place like the Ministry of Health. Members of the Pharmaceutical Society of Nigeria, PSN, donated protective kits.
Little widow's mite to the Federal Ministry of Health.
Receiving the items, Permanent Secretary, Federal Ministry of Health, Abdullahi Mashi, appreciated the gesture, hinting on the government's intention to encourage homemade health products in the fight against the pandemic.
We are meeting with the manufacturers group to see how all these commodities and supplies that we can make use in fighting the virus, that we can empower the local industries to manufacture and source them here locally.
The PSN Deputy President note, pharmacist Muniu Elelu said the materials presented were produced in Nigeria.
There's nothing that our manufacturers cannot produce in this country in terms of essential medicines. And we're up to the task. And now that the government has decided to look inward, we're happy with that and will not let the government down.
He assured of its members' readiness to keep cooperating with government. Demonstrations so far have since been portraying COVID-19 as an unseen enemy, and the fight against it is likened to a war. Actions therefore keep indicating that collective response is the key requirement. In Abuja, Oluseyi Adeagbo, NTA News.
Lagos State Government has appealed to residents who are in the habit of sending false messages and calls to the COVID-19 Emergency Call Center through the toll-free numbers to desist to enable serious cases get the help they require. The State Commissioner for Health, Professor Akin Abayomi, made the appeal during a press briefing on the update of COVID-19 in the state. Nosa Usula reports.
Commissioner for Health, Professor Akin Abayomi, who expressed readiness of the state government to ensure adequate and timely response to COVID-19 cases in any part of the state, stressed that the toll-free numbers were strictly for emergency purposes and should be activated only in distress situations. The commissioner confirmed a total of 120 confirmed cases, 87 active, 31 discharged, and 2 deaths from coronavirus in the states.
We are experiencing a flattening of the curve. Otherwise, we would have seen thousands and thousands of cases by now. Flattening of the curve gives us the time and the resilience to deal with the outbreak.
Professor Abayomi also disclosed that the state government is putting up more isolation centers.
As citizens of this earth, there is the need for all nations to collaborate to bring this outbreak under control.
The commissioner said that the government's statistics shows that the number of coronavirus cases in the state could be reduced further if good social distancing is adhered to. In Lagos, Nusa Osula, NTA News.
This is NTA Panorama from the Lagos Network Center. We shall be right back after this timeout.
Coronavirus is dangerous. It can kill. When you see this sign, high fever, cough, shortness of breath, drowsiness, pneumonia, don't panic, don't hide, don't embark in self-medication. Promptly visit the nearest medical facility. Report all cases to the nearest hospital. Prevention is key. Avoid contact with infected persons. Avoid crowded areas as much as possible. Wash your hands regularly. Use hand sanitizers. Your life is precious. Stay alive. Live long. Live right. This message is sponsored by the Federal Ministry of Information and Culture and the Nigerian Film Corporation. Nigerian Film Corporation, powering possible.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water, or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Many thanks for staying with us. Joining me now live via Skype to talk more about the testing capabilities in Nigeria for the COVID-19 is the Director General, Nigeria Institute of Medical Research, Professor Babatunde Salako. Hello, Professor. Can you hear me?
Nigeria Institute.
All right, Prof. My very first question, what qualifies one for a COVID-19 test?
What qualifies one for a COVID-19 test?
Thank you very much. The Nigerian Center for Disease Control has 3 categories of people that can be tested for now. The first one is a group of people who have recently visited high-risk country, and they are now having symptoms suggestive of COVID-19. The second category are people who have come in contact with a positive case of COVID-19 and are also having symptoms suggestive of the disease. And recently, the third category was added, and that is a group of people who live in a place or city where COVID-19 infection prevalence is high, like Lagos and Abuja, for example. Even though they may not have visited the high-risk countries, they may not have come in contact with a case, but they are now having symptoms suggestive of COVID-19. So these are the 3 categories of people that are currently being tested under the NCDC laboratory.
New approach to testing for COVID-19. approach to testing for COVID-19 in Nigeria now?
Just a minute. To testing for COVID-19 in Nigeria now. I didn't get that, but I imagine that you are asking for
approach to testing is in Nigeria.
Okay, thank you very much. Now, the common approach is that if you have a symptom suggestive of COVID-19, you call the NCDC emergency number, and someone is going to pick the number and listen to your complaint and triage you, determining whether you deserve to have a test or not. If you fit into the group that should have the test done, then you are invited for the test, or they visit you to take your sample, depending on.
All right, Professor, since the outbreak of COVID-19 in Nigeria, what has the frequency of tests for this virus been like?
And invite you to our premises. Frequency of tests for this virus being like? Well, again, it depends on whether you are fit into the category or not. A lot of labs have recently been established by NCDC, and I think we should be counting towards 12 by now. The idea is to increase, especially in Lagos, testing to about 2,000 per day. And there are a lot of people who have been coming, except for this lockdown, which has not been allowing a number of people to come when they have been invited. But in the last few weeks, we have tested close to 500 and something individuals. And on a daily basis, we are getting close to between 20 and 30.
What are your projections for the coming weeks? Do you see more people coming out to test for COVID-19?
Coming out to test? I believe so. Yes, I believe so, especially if the lockdown rule is lifted, then a lot more people will be able to go onto the roads and then visit our site. We have capacity to test up to 50 a day, but currently we are rolling just below that. So if this lockdown is released, then we'll have a lot of people coming for testing.
Negative, false positive, what are the implications of this?
Now, false positive, false negative have grave implications, so to speak, because if such reports are released, it may not assist the physicians who are managing the patient. Where somebody is negative and is reported positive may cause anxiety and may allow physicians to treat the person for a wrong disease. Whereas also, if the patient is also positive and is said to be negative, it will create an opportunity for the patient to spread the disease. But what we have done in some of the labs is to have quality control. Some of these tests are repeated twice, just to be sure that when it is negative, and when it is positive, is positive. But occasionally, we do have some indeterminate reports, and we will have to go and take that sample again.
Just to get your insights on, are we doing everything right in terms of managing further spread of this virus?
In the circumstance, we are doing a lot of contact tracing. We are increasing the number of tests for the categories of people that we have. And those who are positive are also isolated and are going through treatment. And you could see that in many of the centers, the isolation centers, a number of people are getting well and they are being discharged. We don't have many deaths for now. So I would say we are doing our best in the circumstances that we are.
All right, Prof. Many thanks for your time on the program.
It's my pleasure. Thank you very much for inviting me.
Now, Manchester City manager Pep Guardiola's mother, Dolores Salah Carrillo, dies at the age of 82 in Maneres, Barcelona, after contracting coronavirus. Olumide Eguntola brings us this and other stories on Sports Update.
The International Olympic Committee, IOC, recently cleared the